Hi everyone, I'm Balkish from Faculty of Computer and Mathematical Sciences, University of Jemara, Shah Alam, Selangor. And today I would like to share my work titled Handling Imbalance Data in Modeling Coronary Heart Disease. Here is the content outline of my presentation. I will briefly touch on the background of the study, go through the literature, and explain the methodology. Also, we'll discuss the results and conclude. Let me share the introduction, which is the research background. Coronary heart disease, CHD, is categorized as cardiovascular disease, which has the highest mortality rate among all the non-communicable diseases throughout the world. According to WHO and CDC, heart disease is the major reason for death in UK, Canada, and Australia, and it is also a leading cause of death among Malaysians. Heart disease affects a significant proportion of both older and younger people around the world. There are several factors that may increase the risk of developing coronary heart disease, and some of the factors can be controlled, which usually associated with the lifestyle, but some are not. For instance, smoking, high blood pressure, diabetes, and obesity are considerable modifiable. However, those that cannot be controlled are age, sex, and family history. There are numerous health repercussions that affects people's well-being in the short and long term due to the coronary heart disease. Basically, I want to compare the performance between decision tree and logistic regression techniques in modeling the coronary heart disease and also to determine the risk factors of coronary heart disease. For the past 15 years, the coronary heart disease has been among the top 10 causes of death worldwide, and Malaysia is not excluded. Formerly, it affects the elderly population, but now it is also affecting adults as well. Therefore, there is an urgent need to address this problem. The study on coronary heart disease has caught the interest of many researchers. Various studies have been conducted to explore data mining models in predicting the coronary heart disease, such as decision tree and logistic regression. However, most of the studies that did not address the issues of imbalance, which might result in producing a biased classification model, as the coronary heart disease dataset was typically imbalanced. Therefore, in this study, the inclusion of demography and lifestyle profile as well as clinical information and the application of imbalance technique before modeling the coronary heart disease is aspired to close the gap. It is hoped that this result can offer an alternative method in predicting the coronary heart disease. Let me briefly share some of the literature review. In general, factors that lead to coronary heart disease can be categorized into demography, lifestyle, and clinical information. Women tend to have a lower risk of getting coronary heart disease compared to men. And women also tend to develop coronary heart disease at an older age, while men develop coronary heart disease at a younger age. Malaysia had about 44.7 million smokers, where 3 out of 4 are men, and this statistics leads to the male suffering from coronary disease in Malaysia is higher than women. Obesity is also associated with hypertension and diabetes, and these factors are generally blamed for the increase in the risk of the coronary heart disease among obese people. According to Yap, imbalanced dataset happens when one of the two classes of the binary target variables is poorly represented. The existing of imbalanced classification must be resolved in order to construct a good and useful predictive model. According to Arvind and Balakrishnan, imbalanced data need to be handled as it may affect the performance of the model and resulting in overfitting. Decision trees are commonly used in real life and particularly beneficial in illness and heart diagnosis and have been used in various research papers to predict heart disease. And Latifah utilized the Framingham Heart Study dataset revealed that logistic regression has a higher accuracy compared to random forest when predicting the 10-year risk of having coronary heart disease. Based on the literature review, the methodology for modeling the coronary heart disease will be discussed. This study used a secondary data available on the Kegel website, which is an ongoing heart study of Framingham. The dataset provides 4,238 patients information with 15 potential risk factors. These are the variables involved in modeling the coronary heart disease. Method of analysis will be divided into four. First part, we're going to talk about data preparation, then data partitioning, modeling, and model performance. In data partition, some of the variables that having a missing values will be imputed using the tree surrogate, and the imbalance data also will be handled here by using the undersampling method. And in data partition, the data set will be divided into training and the validation set. And after that, in modeling, we're going to model it using the decision tree and logistic regression model. And for model performance, we are going to use the sensitivity, specificity, and accuracy to measure the performance. Now I'm going to share with all of you the results of the study. Here are some of the descriptive analysis on the variable involved. We can see that female participants are slightly higher than male participants, and majority of them are high school graduates. In terms of their lifestyles, the number of smoker versus non-smoker is about the same, but we cannot deny that the second largest group is heavy smokers, with 394 participants that smoke 20 cigarettes or more every day. 56 participants had taken a blood pressure medicine, which means that they are already at stage 2 of hypertension, and this condition can increase the risk of heart disease. About 14 participants had a stroke before and are prone to suffer another stroke. About 524 participants have had a history of hypertension, which can lead to other heart complications. And not only that, 49 participants have already had a diabetes that can also increase the risk of heart disease. Here are the descriptive analysis of some of the continuous variable. Average age of the participants is 51 years old, while the youngest participants are 33 and the oldest are 70 years old. So from here, we can see that most of the participants are senior citizens. And in terms of BMI, it indicates average. When we talk about the average total cholesterol, it indicates a borderline high. And the systolic blood pressure indicates that it's on the hypertension side. However, the average of diastolic blood pressure, heart rate, and glucose level are all within the normal range. Before proceed to model building, there are two things that we're going to check, which is the missing values and some of the variables that has missing values. Imputation using tree surrogate method was used to handle this. And for the imbalance issue, we have the imbalance issue here because the participant with coronary heart disease is only 15.19%. So the undersampling method was applied to balance the data set before we built the predictive model. The first predictive model that we are going to build is decision tree model with three splitting algorithm. Based on the performance measure here, we can see that entropy splitting algorithm exhibits the ability of predicting positive outcome much better. As the focus is to find the best model that is able to predict the possibility of having coronary heart disease, therefore higher sensitivity value indicates a better model. So in this case, our sensitivity value is 0.8224, indicating that the model can predict correctly a proportion of patients that have a risk of developing coronary heart disease by 82.24%. Therefore, decision tree with entropy splitting algorithm is the best model. Next, we built logistic regression with three different feature selections, and based on our model performance measurement, it indicates that logistic regression with backward selection exhibits a higher sensitivity value and accuracy value compared to other selection method. Therefore, backward selection method is the best model for logistic regression. Now we are going to compare those two best models, which is the decision tree entropy and the logistic regression backward. So from here we can see that entropy splitting algorithm exhibits the highest sensitivity. Again, as our interest is in predicting the patient risk of developing the coronary heart disease, therefore we will choose the decision tree with entropy splitting algorithm as the best model. So in this case, we are traded in the marginal differences between the accuracy of both models for a better model that can predict patient risk of developing coronary heart disease. The comparison between data set being treated and without being treated for the imbalance issue is shown here to support on the selection of the best model. So from here you can see that decision tree with entropy splitting algorithm without treating the imbalance issue gives a higher accuracy, a higher specificity, but a very, very low sensitivity that exhibits the imbalance issue in the dataset. Hence, the selection of decision tree with entropy splitting algorithm with treated undersampling technique is the best model. Based on the best predictive model obtained, the significant attributes were identified. From here, the most significant attributes was age, followed by gender, systolic BP, BMI, glucose, and total cholesterol. The finding was in line with prior study done by several researchers. Here are the findings of some other researchers that in line with my studies. Now we come to the conclusion. This paper aims to predict a patient risk of getting coronary heart disease using two data mining classification techniques, which is the decision tree and the logistic regression. After looking at several measurement performance, we can make a conclusion that decision tree with entropy splitting algorithm treated with undersampling technique is the best model. And age, gender, systolic blood pressure, body mass index, glucose, and total cholesterol level were identified as the risk factors for detecting the coronary heart disease. Both decision tree and logistic regression model were used in this study. However, there are other data mining techniques that can be considered like random forest and SVM for future studies. In addition, there are also other imbalance techniques that can be applied, such as Mohd and hybrid to handle the imbalance data. And other risk factors also can be considered for future studies. With that, thank you.